My name is Dr. Ijlal Ali, and I am a gastroenterology physician with OU Health. I've been practicing with OU Health for the past 1 year as a faculty physician, and before that I was a fellowship trainee here and as well as a internal medicine resident here. I started as a resident and then as a fellow here, and I spent 6 years here. And during that 6 year timeline, I really got to enjoy working with all of my colleagues here, all of the faculty members, and I enjoyed serving the population of Oklahoma City and the surrounding counties as well. I believe that there's a real big vacuum that we can help fill and help serve the needs of the patients from the whole state of Oklahoma, really. And that's why I wanted to stay on and help with that process. I got interested in gastroenterology when I was doing some research before my residency application in the United States. And I got attracted to gastroenterology because I believe it's a very perfect amalgam of surgical intervention as well as medical clinical care of patients. And so you can address a wide variety of pathology that you see in patients from both a physician standpoint and from a technician or a surgical standpoint. People would come and see gastroenterologists for a variety of reasons. Some of them include for screening procedures like for reflux or for colon cancer screening with colonoscopies. More commonly, we see patients in clinic for bloating, abdominal pain, GI bleeding of any kind, as well as persistent reflux issues. My specialty within gastroenterology focuses more on the motility aspect of things, and I focus on motor function disorders of the food pipe or the esophagus, and also motor function disorders of the rectum or the anus as well. The motility program at OU Health is growing by leap and bounds over the past few months. We have introduced a new technology which is called EndoFlip, which uses a special balloon with which you can try to detect the motor function of the esophagus. And the good thing about this is we can do this during the endoscopy procedure. So you won't have to come back for a special procedure in which we would insert a catheter down the nose into the food pipe to check your motor function. So it can help as a one and done stop for you for your upper GI symptoms. So patients will benefit from the multidisciplinary care here because we have surgeons, advanced endoscopists, and motility specialists coordinating their care for complex disorders that they might have. For example, somebody who has achalasia or an abnormal relaxation of their food pipe that will present as problems with swallowing, we can detect that accurately via the motility specialists, and then they can be fixed by either undergoing an endoscopic procedure by our advanced endoscopist or by a surgical procedure by our general surgeons or by our foregut surgeons as well. We can talk about them together in our foregut conference that happens every month or so, and decide the best care plan for them. My practice mainly focuses on complex patients who have been seen by other primary care providers and even other gastroenterology physicians in the state, and who have complex conditions that need further evaluation and coordination of care. I see a lot of patients who have issues with complex IBS or irritable bowel syndrome, or complex motility function disorders such as achalasia and spastic esophagus disorders as well. And because of the multidisciplinary care that OU provides as a tertiary care referral center for the state, we are best placed to help manage their complex problems.